As the pandemic puts vulnerable populations at increased risk of illnesses, families have been searching for safe and suitable care for their elderly loved ones. Our 13 News reporter Natalie Wattis joins us live from the Huntington newsroom with an option more families are choosing. Natalie?
Marilee, nursing home and assisted living residents are among those who are the most vulnerable to COVID-19. That's one reason why in-home healthcare professionals say their business is booming.
When I first started off in this industry 15 years ago, there was not a very good awareness of the home care industry. People were somewhat familiar with medical home health care, but they weren't familiar with home care.
But then the pandemic struck, causing a lot of people to rethink how their loved ones were being cared for in assisted living facilities. Anna Chandler is one of them.
There hasn't been an outbreak with the residents, but there have been a few cases with the healthcare workers. So another reason that I'm bringing her back is she'll be exposed to less people.
It's a trend Chandler says she's noticed with others as well.
I do know of several neighbors who have gone this route with home caregivers. Their main reasoning for it was so that the family could still be involved.
Right at Home President Eric Hicks says they've definitely seen an increase in people wanting these services.
When the pandemic first hit this area towards the end of March, we took a decline in business for a couple weeks, and then after that business really took off. We regained what we had lost within a month, and since then business has continued to grow at about 11% pace.
He attributes this business boom to a few things.
There were a lot of restrictions with assisted living. When you look at the demographics, you have an aging population and people would prefer to be at home. Also, you're seeing a big growth in telemedicine.
And of course, the rising cost of health care.
The expense at the assisted living facility is just outrageous. It goes up about $500 every year.
Even as more and more people get vaccinated for the coronavirus, Hicks says he believes demand for in-home care will only increase.
I think there'll be continued growth in this industry, in part because we as a society can't afford or sustain the health care costs of institutionalized people.
While the in-home care route may seem safer and more cost-effective to some, Hicks warns that West Virginia is a non-licensed state for in-home care. That means there's no special designation needed to do this work. So always be sure to closely look into a business before hiring them to care for your loved ones. In the Huntington newsroom, Natalie Wattis, 13 News, working for you.
All right, Natalie, thanks so much. We have more information about in-home health care on our website, WOWKTV.com.